Hey, welcome back to the Dr. Jim Cares podcast. My name is Dr. Augustine from Head to Wellness, and in today's episode, we're going to do part number 2. Actually, it's another case study, a real patient case study, and I want to describe to you how we get the kinds of results that we do in this practice. It's so much fun. Really excited about what we do because we actually get people to heal and resolve their healthcare problems. Classically, and I blame this on my mom. My mom passed away of really dreadful illnesses, and those are the type of patients that I attract. So chronic illness, from anything from cancer, autoimmune disease, diabetes, high blood pressure, cholesterol, things of those sorts, heart disease, things like that. Now, I'm saying that these are the types of patients that we see a lot, and we actually get people to heal from these various problems. Does this conflict with medicine? Am I practicing medicine without a license? Absolutely not. My focus entirely is to get a person to heal and see their body get healthier. Never do I treat disease. So I want to make that very clear. So today we're going to talk about another lady, actually, and we're going to talk about, in the context, here's the framework that we look at: a patient's story, their symptomatic chronology, how their symptoms have developed, how complex their condition is. We're going to talk about holistic healthcare. How do we solve these problems? We're going to talk about diagnostics, the testing that we like to do to get them to heal, and what is the healing process for these patients. We're going to talk about comparison with conventional, say, healthcare, and let's talk about the outcome. Really cool to see the results of, did we actually make a difference for this patient? So this patient, Linda, is a 61-year-old female who has Crohn's disease. She had her ascending colon removed. Blood sugar's rising. Her hemoglobin A1C is up to an 11, not good. She's had 20 to 30 biopsies every time she has a colonoscopy. And she's on Entyvio, a biologic medication to literally shut down her immune response, so her immune system stops attacking her digestive tract. So not happy. I saw this patient years ago too, with sort of the beginning stages of this problem, and at that time she was complaining about overactive bladder, major bladder complaints and symptoms. Another sort of aspect of this can be cystitis, your cystitis, inflammation in your bladder. And ultimately the cause, which we discovered, was really not her bladder wasn't the issue. It was more so her intestinal inflammation, because they share the same nerve supply. So you could, not that I swear, but you could swear up and down that you have pain and symptom and problems in your bladder, when in fact it's all the inflammation around the bladder in the intestines. So that was the clinical picture of this person. So the complexity of it, when we did testing, and some of the testing that we did was called, one thing that we do is called a Menla Scan Pro, as well as something called heart rate variability. Menla Scan Pro, I like to call it the full body scan. Non-invasive scan, there's no radiation or imaging involved with this, but it measures how these organ systems and tissues are functioning. Gives us information about cellular health, also just an array of full body information, so we can kind of put the pieces of the puzzle together to figure out, what do we need to do? What are the most problematic tissues? And again, our goal is not to treat with medication. Matter of fact, the word treatment is not even in my vocabulary for what we do. That's what medicine does. They do enough testing to discover a disease process. Then that disease process will fit with a standard of care of different types of drugs and medical procedures. Can be surgery as well. In this case, this poor woman had the surgeries, so not good. And yet she's just beside herself with symptoms: exhaustion, fatigue, massive gut pain, bladder problems, the same stuff happening. So this is not good. So let's talk about what we did. We did heart rate variability, and her HRV, which measures heart function, EKG based, measures heart function, but more importantly, it demonstrates her autonomic nervous system function. And imagine having a significant problem in your gut. Well, the only place besides your brain that has the most parasympathetic, rest and digest side of your nervous system, besides your brain, is actually your gut. So what we find is that when we do heart rate variability, is there is a very specific pattern that we see within this. Plus, we also see that the Valsalva test is extremely low and in a severe range. So this is what we found with this particular patient. Now, the full body scan demonstrated that she had definitely problems in the small intestine, large intestine. She had lots of chronic inflammation. Her liver was a problem, her stomach, her pancreas, her adrenal glands. Her heart was a problem because of blood sugar. We see this almost, I wouldn't say every day, but we see this all the time with people that have any level of blood sugar. You can start to see it developing because it starts to develop in that microcirculation score and the 5 markers that we actually look at for blood sugar problems. And you can just totally see the connection to causing heart disease and problems there. So we did, and our approach with this is never to remove medication from a patient. That's not what I do. It's not within my license. But I'd suggest, wouldn't it be a good thing if we can get your body tissues to heal and resolve to the point where you wouldn't need medication? And usually their doctors would agree with that too, but there's obviously a need there, and I'm very common sense about what we do. I tell people very, very specifically, my approach is to get you to heal and resolve problems. There is definitely a place for medicine, and usually it's crisis care management, meaning that you get hit by a bus, have a heart attack or stroke, they definitely can save your life. They're phenomenal at doing those things, but they just can't get you to heal. We like to do that. We like to actually work on, let's improve a person's health, get their body to heal and resolve. And then logically, if you don't need the medication, let's just say blood pressure, for instance, if your blood pressure is now low and stays low, then of course you're probably not going to need your medication. I will send that patient back to their doctor and let them have a discussion with their doctor so that they can change things. So this particular patient, 6 weeks, within 6 weeks of our care, her sympathetic stress side of her nervous system really came down. Why? Because we're calming and relaxing, shifting her parasympathetic up and forward. Her ability to recover, which is demonstrated through her autonomic nervous system, that's better. Her performance, day-to-day daily activities, or they call it the activities of daily living, definitely has improved. Her vertebral spinal score, which actually pulls data not from your spine, but from the organ systems that your spinal nerves control, that score went from a 52 up to a 75, really significant change there. Autonomic nervous system score went from a 50 up to an 85. That was a big change there. Why? Because that's what controls healing. Autonomic nervous system, not me. Body composition went from a 57 up to a 68, so she's losing body fat. Everything I told this person to do, she did. She did it perfectly without even question. Why? Because she was so awful. She was so terrible with her symptoms. So when you have enough symptoms, you'll actually make those changes. And I hate to say I'm thankful, but I am thankful because she's having tremendous changes in her body. Her body fat went from 41.9, so 42% body fat down to 36 in 6 weeks. She really listened to me when we said change your diet. Microcirculation score, blood sugar problems, went from a 63 up to a 71. Phenomenal change. Cardiac output, how much blood her heart pumps out each heartbeat, better. Blood volume, better. Reflection index is the small and medium artery stiffness, more relaxed. Her SpO2, so the blood oxygen saturation, improved and increased. The overall health of her autonomic nervous system, also known as SDNN, that improved. RMSSD, which is parasympathetic health, improved. Power VLF is adrenal gland function, that improved. Power low frequency, again, sympathetic nervous system measurement, improved. Her low frequency, high frequency ratio decreased because of less internal stress in her body. Her body is definitely in a healing mode. Her LDL cholesterol reduced, really good. Metabolic syndrome indicators improved as well. And this is just within the first 6 weeks. So she is happy as a clam. She's really excited about her results. Now, if we compare the conventional approach, we sort of did in the beginning because I told you that her doctors had removed part of her colon and she was on Entyvio to literally shut down her immune response from attacking and destroying her body tissues, whereas we're getting her body tissues to heal and getting her immune system to normalize. Huge difference, because if you don't solve the root cause of these problems, such as your lifestyle, the problems never go away, and you will necessitate medicine. Common sense. So her outcomes were very, very dramatic. Loved this. She's very happy, and I'm very happy when she's happy. So what's the follow-up and future plans for this patient is to continue her care, because this was just the first 6 weeks. So I'm expecting that she could probably make pretty much a complete and full recovery within 6 months of care. It definitely takes time and consistency to heal. And why would that be? Because the example would be, if you want to build some muscle on your body, how often should you go to the gym to lift weights? How much should you change your diet? And for how long? Well, I would say that within 6 months of lifting and exercising and changing your diet and maybe taking some nutrients, you're probably going to get some significant changes that are obvious within 6 months. So to have complete healing and resolution within 6 months, I'd say that's pretty darn good. That's the plan, and we will see. And along the way, how would we know? As we test and measure along the way. Classically, every 6 weeks, we measure to see her changes and improvements. Because let me tell you, if I can't help somebody within 6 weeks, there's no change, I can't help these people. The reality is actually I don't have anybody like that. Everybody that I see that is actually involved with me taking care of them, everybody improves. There's been a few stage 4 cancer patients that I couldn't help because they were beyond repair. And very, very sad about that, but oh my goodness, everybody that I get my hands on, we have great changes. Part of the process. Now, how do we do this? What's our approach to this is, number one, biocranial to improve a person's autonomic nervous system. Number two, we do something that's called high voltage PEMF, or pulsed electromagnetic fields. High voltage though, specifically high voltage. Number three, dietary changes, very, very precise dietary changes. And then number four is targeted, really specific nutrients and herbs that make such a difference. This approach, plus some other lifestyle things like getting more sleep, exercising a bit, things of that sort, great, great, great approach. We always get great changes. And so I'm very happy, and so is this particular patient. So with that, if you have any health issues and challenges that you might like some help with, or you have some questions about it, please feel free to contact me. My email is draugustine@gmail.com. You can call my office at 562-860-3404. I'm on social media, TikTok, Instagram, as well as YouTube. So you can also watch some future videos as well, because I have a lot of good content there, again, to help you really get to bottom line root causes of things and start to get your thinking differently towards solving the causes of these problems as opposed to only just treating symptoms. So I hope this helps. Please leave some comments down below. And I'm also on podcasts. I want to tell you that too. I'm on Apple Podcasts, Google Podcasts, Spotify Podcasts. So like and subscribe there too. That'd be great. My name is Dr. Augustine. I hope this helps you. Let me know. And we will see you next week. Have a great day.